In this demonstration, I will explain the differentiating auger that we have for our bacterial identification, the process for streaking for isolation, and also some things that we should try to avoid so we don't prolong the culture results being put out to the patients. Right here we have our sterile plastic inoculation loops that we use for our quadrant streaking. They are very flexible, which makes it easy for them to apply the organism or the inoculum to the auger without actually gouging it. They hold 1 microliter of sample of fluid, or the other way that we use them is we use them to drag inoculum from one quadrant to the next quadrant. These are the 5 plates that we use in our laboratory. We have sheep blood, and this grows most gram-negatives and gram-positives. Chocolate, which grows our fastidious organisms and all the other organisms we have. The McConkey grows your gram-negative organisms, and then the CNA grows your gram-positive organisms. And then we have our chrome sheep blood biplate, and this is specifically for urines only. Here we have all 4 plates of a respiratory culture. You can see that there's growth on each individual plate, and we can differentiate the growth of pathogens depending on what growth is on what plate. So this is the sheep blood plate. Like I said before, it will grow most organisms other than your fastidious organisms. So looking at this, we'll have gram-positives and gram-negatives. I want you to notice the streaking pattern, how it reaches out to the entire plate. We streak in a 4-quadrant position, and so we should have a first, second, third, and fourth, and the whole plate should be used up. You can see on this chocolate plate that it has very similar streaking pattern and inoculation pattern, which means that the bacteria was dragged out from the first quadrant to the second and a little bit into the third. You can again see the streaking pattern there, that the whole plate was used. The McConkey and the CNA, because they have antibiotics in them, we won't get as much isolation, but you will be able to correspond what's growing on here to the chocolate and the sheep blood. And then the CNA plate that we have here grows all gram-positives, and so you should be able to correlate this plate with the sheep blood plate and be able to say, okay, yeah, we've got these gram-positives, those gram-negatives on McConkey, and then you can see everything coming together on the chocolate and the sheep blood. You can see here that we have a different little streaking pattern on our urine plates, and that's just to quantitate the number of colonies. We have our quadrant streaking, which I showed you previously on this plate above, and that is to quantitate for quadrant, but also isolate the colonies out so that we can test and identify those individual colonies. This is quadrant streaking. We've got our first quadrant, which you inoculate fairly heavily. You're going to take your loop on one side and dip back into the first quadrant multiple times and drag all the inoculum from the first quadrant up through the second quadrant. You're going to use the same side of that loop to drag out your third quadrant. You're going to flip the loop around and drag out your fourth quadrant using the entire plate. I just wanted to highlight something on here for you guys to see, which is where we have some of our issues if it's not done properly. He's going to take his loop and diagonally streak out of that first quadrant. So dip in multiple times and diagonal streak. So he's dragging with the side of that loop out of each quadrant into the next, which helps that isolation happen on the plates for us. The main issue we have here with streaking is you can see the streak pattern comes side to side outside of the first quadrant and does not allow for dragging those colonies out, and we cannot get isolation. This one you can actually see the diagonal pattern coming out, and it is allowing to drag those colonies out so that we can have isolation for testing. The next problem we encounter, so this one on the left is actually very good. There's diagonal streaks directly out of the first, second, and third quadrant. We get a lot of the plate used right there into the fourth quadrant, which gives us isolated colonies. If you look on this side, they do have diagonal streaking, but they only use about half of the plate, maybe 3/4 of the plate. Therefore, we're not getting the full use of the plate for isolation. All right, so here are a couple things we're hoping to avoid. So not enough inoculation in the first quadrant. So if you're not putting much in there, you won't be able to drag much out of there. So that's just something that we need to try and avoid. the side-to-side streaking is not dragging any colonies out. It's very hard to get isolation, and so everything being in that first quadrant could very well be mixed, and we wouldn't be able to isolate it out quickly enough, so we would have to sub it out, increasing our culture for a full other day. You can see this person did use the full plate, which is very nice, but if you're not streaking out colonies, the full plate's not going to matter. The upper right-hand corner, you can also see where they didn't use the full plate. They still did 4-quadrant streaking, they did diagonal streaking, but it's such a waste of a plate if we need those isolated colonies for testing. There's a big portion right there that doesn't even have any streak pattern on it at all. So that one again, there's a big portion right there with no streak pattern on it. When you get a respiratory culture, skin culture, those things have a lot of bacteria. All that space used is necessary so we can isolate out those colonies. Here are the things we are looking for. Use this full plate so the tech can isolate out the quantity of the organisms and also have isolated colonies to test so we don't have to sub things out and extend the culture another day. The nice diagonal streaks, which are really helpful. We have a good inoculation in that first quadrant. We also have streaking all the way throughout the plate using everything available. Dips into quadrants multiple times to pull and drag organisms into the next quadrant. So dipping it once or twice isn't going to do the trick. It's recommended 3 to 5 times so that we can get adequate colonies coming out into the further quadrants. Like I said before, enough inoculation in the first quadrant. Here's a great example of having enough inoculation in the first quadrant, but only dipping into that second quadrant twice and not getting anything carried out into the other quadrants. So overall, if we get enough inoculation on that first quadrant and we drag out accordingly to the consecutive quadrants, we should have isolation so that we can find those pathogens and not extend the culture out by having to make subcultures each and every day, which in turn is best practice for the patient. Thank you so much for watching this video, and I hope you gained some knowledge from it.